There we go. He's talking.
Good morning, everyone. Good Friday to you. Welcome back to our COVID-19 Innovations webinar here at RUHS. Just a quick reminder, make sure you're turning your volume off of your computer or phone if at all possible. But again, thank you for being here. This is our fifth day in a row coming together to talk about innovations and ideas of how we can tackle the challenges that face us today. I'm going to hand this off to Ed and Jacob.
Well, good morning again. This is our third time this week, and we're pretty honored to be able to be part of a solution as we go through the challenges ahead. And so, again, my name is Ed. This is Jacob, our respiratory care educator. And today we're just going to talk about two simple things that we came up with to be able to go ahead and continue to provide safety to our patients and also to our caregivers. That way we can continue doing it for an extended period of time. So today, right before, we're just going to do a really quick overview and we're going to go ahead and play the video. But today we're going to be talking about this particular kind of gadget. Hopefully you can see it on the camera there. It's really just a CPAP mask. We kind of rigged it a little bit with a little blue elbow here, a T-piece, a filter, and of course this is our nebulizer right here. And so what this does is that we're able to go ahead and continue providing nebulization to the patient, especially this particular kind is called an aerogen nebulizer, which basically we can use for continuous nebulization. And so in the video, we'll talk a little bit more about it. After the video, we'll go ahead and kind of just break it down a little bit more. And of course, the last one is going to be what we lovingly deem our homemade CPAP machine here. And of course, you'll see a bunch of little wires and tubing and mask here, but the video will go ahead and talk a little bit more about it. And then after the video, we'll come back and we'll be able to, again, dissect the products a little bit closely, and then we'll take any questions regarding the two products that we're about to show. Okay, so let's go ahead and we'll do the video right now.
What we got here is a system to be able to give a continuous albuterol to a patient while giving constant pressure, CPAP. So what we were doing as far as a plan was to do MDIs, but for those patients who are in severe distress, pediatric patients, we need to give them a little bit of pressure because they're hypoxic. They need some treatment to open up their airways. And so what we've done is we've put together a BiPAP mask. This is a large one though, but we'd have a small one for the pediatric cases. We used a continuous aerogen system connected to a T-piece, used a filter, a bacterial filter, 0.27 microns, 99.99% filtering. So we hook up our at the bottom over here, it'd give enough flow. We'd put the treatment albuterol in the cup here, place it on the patient, and they'd be able to breathe while getting a continuous treatment, and it would prevent aerosol from escaping. Is that with the COVID-19, you don't want to expose people to the aerosols. So the whole idea was to only give MDIs. The issue with the MDIs is that when you get to a certain well, if you use all your MDIs, if they're short in supply, then you're going to have to come up with a different way to nebulize your treatments or to give your treatments. And this was the way that we came up with it. Okay, what we have here was sort of like a homemade CPAP that was developed down in the ER by Dr. Mattal, Kyle, and a few other people, and we kind of modified it. And so what you got here is an ambu bag. You have a bacterial filter, you have a H-line or end-tidal CO2 monitoring. On the other end, you have a T-piece for a Misty Nebulizer for albuterol or whatever medication that you're going to deliver. And then you have an oral nasal BiPAP mask. And so what was done is that we removed the elbow that would be here connected to your oral nasal mask, put a blue adapter. Blue adapter was placed on one side of the larger side of the T-piece. And it fits really good. The large part just slides right in there, and the rubber adapter kind of makes a really good seal. And it's really hard to get out. Okay. The idea of this T-piece is when you put a Misty Neb on here, it'll push up the spring and open up the little cap inside so that your medication can go into the mask and to the patient while he's breathing. The story behind this is if we're going to give medications, we're out of MDIs. And of course, if you have a patient in distress, you want to give them a continuous breathing or some kind of breathing treatment. You want to do it so that you don't have any aerosol coming out of the mask or of your system, because it may contaminate other people with a COVID-19. So the idea was to be able to give positive pressure while giving a treatment and not exposing staff unnecessarily. So the way it works, you'll connect your bag into your O2 source. Make sure you got adequate flow in your reservoir bag. And you can also, if you need to assist the patient in breathing, you can also assist in ventilation. But this is meant to be a CPAP device, low CPAP. You can adjust your CPAP level by adjusting your PEEP valve. So typically, we'll usually have them at 5 to 10. We're monitoring end-tidal CO2 with your H line. Have that plug into the monitor. And then when giving your treatment, you're also adding flow on the mask with the treatment. And so what's monitored back here is your PEEP with your pressure manometer. It's not coming from the bag, it's actually coming from the O2 connected to the front of the bag here and with your treatment. So you're able to give positive pressure while administering a treatment in the ICU on the front lines without exposing your coworkers and patients.
All right, there we go. Okay, thank you. So thank you guys for watching that video. We just kind of want to go over it one more time, just a little bit, in a little bit more detail if you want. What we're going to talk about right now is let's go ahead and talk about the closed system that we have here for continuous nebulization. Now, one thing I want to make sure you guys understand is that we can use either the single small mask that is for either adult or pediatric, or we can also use a full face mask that we so lovingly call the fireman mask that we used earlier in the week for the filtration for our staff. So those are the options that we have. Again, the mask, you really do need an elbow. You do have a T-piece right here with the filter, which is actually 0.027 filtration for the microns, which is above the threshold of 0.03. Here we do have the Aerogen system that we use here. One thing of note that we want to make sure you understand is that you do need to have some flow going in through here. That way you have the CO2 kind of wash out up in the mask. If not, you're going to go ahead and start to accumulate the CO2 gas here for the patient, and we definitely don't want that. So this is a system that we have developed for continuous nebulizations, even though we are going to an MDI system that we are going to be discussing on Monday. This is something that we have put in our arsenal in case a patient comes in who's an asthmatic and definitely does need some sort of a continuous nebulization. This is something that we can protect the staff as well as provide great care to our patients. So Jacob's going to kind of describe a little bit about the homemade CPAP. This actually came from an idea from our ER doctors, and so we're so thankful for their forward thinking as well. And so we took that idea, we kind of modified it to simplify it a little bit and still provide us the same end results with less pieces. And so I'm going to go ahead and hand it over to Parker, and he'll go ahead and talk about that.
Okay, so I'm just gonna try and break down this system for you guys as best as I can here. So in the video, this is a small BiPAP mask. We took off the elbow. We're able to fit. You guys can hear me now. Yeah. We're able to fit the T-piece here. This is actually for giving a nebulized treatment. There's a one-way valve in here. So when you actually press and place the nebulizer in here. It kind of fits and pushes this valve, spring valve up, allowing for nebulization to only occur within the circuit into the mask. And it's retrofitted here by taking off the elbow and fitted with the 22 millimeter blue silicone adapter. So we just cut some tubing to length, basically be any length, but we want it long enough to where it can just lay in the bed next to the patient, the bag. And when you go to the bag, we have a filter here. And then we have the end tile right behind it. Now this end tile doesn't necessarily have to be here. It could be closer to the patient, but we just put it here just for easy connection purposes. One thing I did want to mention too, in addition to using the 15 liters, up to 15 liters of flow through the bag, this is a bag mask valve. Obviously, it's a self-inflating bag. It's not a flow inflating bag. So a lot of the flow, once this entrainment bag inflates, a lot of the oxygen is actually going to escape. So what we did is we wanted to add another port of oxygen here at the valve to increase flow within the circuit to try to obtain the CPAP levels we really want to try to achieve. Here is the pressure manometer here on the side. And this is actually going to give us the right kind of targeted pressures that we want to achieve by adjusting here, adjusting our flow on the flow meter, and then also checking where this, it's like a spring valve, checking the right kind of pressure that we're giving to the patient. So this is just something that is just another method to use in our arsenal here. If we run out of available CPAP machines, this is something that can be easily made within the ER within a matter of minutes, and can easily help with patients with shortness of breath and by giving nebulized medication through the circuit.
All right. Okay, so that's a little bit of what we have here, and we'll hand it over to Dr. Thompson right now, and if you have any questions, please provide them. We're ready to answer as many as you have.
Fantastic presentation. Again, if there are any questions, please bring those forward. I don't see anything on the chat line, but if you want to unmute your computer or phone, please don't hesitate to do that. Perhaps a question that many folks sort of think about with respect to the innovations here is, to your knowledge, has this been used anywhere else? Is there any literature on the topic at all? Maybe you can comment a little bit on that.
So there is a paper written on the homemade CPAP. We just basically kind of modified it a little bit to use less parts and still provide the same outcome. So there is writing, I believe it's MCRIT, if I'm not mistaken, is where the idea comes from. So that is something that's out there. The continuous nebulization product is something that we came up with. We basically put it on ourselves to make sure it didn't have any leaks. So this is a homegrown idea. I should patent it, but anyway. But this is a homegrown idea that we came up with, and we believe it's a great system. We haven't used it on a patient yet. We haven't had the opportunity to, but we feel very comfortable and confident that when the opportunity presents itself, it will work as it should.
Very good. Very good. There was a question that came through the chat as far as how do we get a copy of this presentation. I just want to emphasize to everyone that we have these videos set up on our RUHS YouTube website. That link should be attached to the chat area. So please pull that down and add that to your favorites so that you can continue to view these videos as they come out throughout the week. We have videos for each of the presentations that we have done this week. So again, this is day number 5. Looks like there are some other questions. In this situation, will this eliminate the need to wear I guess a PAPR during treatment and or wait 1 hour after neb treatment. So would this eliminate the need to wear those protective devices, anything else that you would have to do from a staffing protection standpoint?
We feel that even though it's a closed system, we really do want to continue to encourage the staff to really wear PPEs and cappers as well. It's very important for the safety of the employees to be able to just to protect themselves. Always take that extra step. It doesn't hurt to do that. Again, this is just an option. I know there's another question on here saying, do you mind sharing the reference on the CPAP? Absolutely, we will share that. I know it's an MCRIT research that our ER physicians actually had. We can definitely provide that and send it out to the team meeting here as well. Are you utilizing PPV or passive oxygenation via? Yes, we requiring intubation. As a matter of fact, we still are. We still are providing some oxygenation. A lot of it is coming mostly from a nasal cannula, up to 6 liters. We want to again reduce the amount of aerosolization. So yes, we still are as part of our ER protocol, and our ER physicians are still desiring that to continue. So those are the questions that I see on here. And if there's any more, I don't know, do we have any more? But I'm going to hand this over back to Dr. Thompson.
Some great questions. We appreciate that two-way discussion. I think that's the benefit of these webinars, so that we can learn from each other. On that point, I'd like to again emphasize, if any of our partners, hospital partners out there, if you have any innovations that you'd like to share, again, either with RUHS or our other 17 county partners, let's please have that exchange. We've also added the website webinar at ruhealth.org. If you want to, please give us any policies, procedures, any literature that you've found that would support any new innovations. We'd love to have that and look at new ways to optimize patient care and staff safety. Are there any other, I guess, comments with respect to the devices here, or perhaps you have any other comments on preceding topics that we've discussed, or have any requests for future discussions? We can also discuss that now as well, if you'd like. If you have any comments, please unmute your phone or computer and we can address those.
I have a comment. This is Karen Sersky Martin from Kaiser Riverside. I am wondering if there's any opportunity for us to do some community education with families regarding if they become ill and they have a BiPAP at home, to bring it with them.
Yeah, that's not a bad idea. The one thing about this is Ed again. The only thing regarding the BiPAP machine is that we're trying to minimize the aerosolization of that. So the one thing that we actually have been able to develop is we actually have filtered BiPAP circuits. So we're able to still use our V60s. The only thing is that we're only going to be using them in a CPAP format, not a BiPAP. So that way we don't have that the IPAP part of the BiPAP be able to not promote a good seal. And so we're talking about just a CPAP. We have not discussed about having patients leave their mask home. It actually is not a bad idea, but it's something to discuss. But yeah, if it were up to us, and the way that we've been thinking is we prefer to put them on our machines. That way we filter everything, and because we don't know we can filter their machines. And we want to reduce the risk of exposure to our staff.
Might be a bad idea to have them bring it in, and at least have your staff check it out, and and just another resource device that can be used. Absolutely. Yeah.
But again, filtration is our biggest concern, is to make sure that we really protect our team. Good question, though. Thank you.
Any other questions or comments? Okay. Well, we're within our target time here. We're again shooting for less than 30 minutes, just being respectful of everybody's time. We will continue this webinar on Monday. We'll again have our respiratory team back with us, looking at multi-patient single dose inhaler therapy. Again, focusing around our respiratory care and safety around the COVID crisis here. We look forward to meeting again on Monday. Again, as I've emphasized before, thank you very much for your participation. I want you all to stay safe and again, continue all the hard work that you are all doing. So thank you again and all the best.